My name is Alexandra Korchev, and this is my informative speech on culture-specific nursing cares on Hispanic and European Americans. The purpose of this speech is to inform my audience about the culture-specific nursing cares of European and Hispanic Americans. This speech will include basic information and characteristics of each culture. We will clarify misunderstood stereotypes and have much information on nursing-specific customs. By the end of this speech, you will have a better understanding of the Hispanic and European American view of healthcare and how you can better assist anyone of diverse cultures with healthcare concerns. The European American. This relates to me because my father's parents were from Swiss and Russian descent. My grandparents today. In the article, Caring for Older Adults Holistically, many are mistaken for Americans because of their white complexion. Many speak English and have an accent of their origin. Each European country has its own individual culture and from its region of the world. European Americans are as diverse as Americans because they have a constant immigration there. Sensitivity and thoroughness is needed in the nursing cares. One of the major differences in healthcare delivery between most European countries and the United States is the understanding that each has a responsibility in delivering healthcare. In the article, Care of Europeans' Older People, many European countries have national healthcare plans with socialized medicine. Being said, there's an expectation that the federal government is responsible for each person's health care. And in the article, Work and Retirement, How Do European Older Adults Use Their Time? It also describes the United States healthcare as being individualistic and reliant on family or extended family groups, and this being challenging for European adults to accept in America. Nurses need to be aware of this potential problem and refer a patient to a social worker for more information if needed. Nurses should assist the patient with scheduling appointments with the social worker. Hispanic Americans. This also relates to my culture because my father was born and raised in Guatemala and my mom immigrated from Cuba as a young child. Okay. The Latino and Hispanic population is the second largest emerging majority group. The term Latino and Hispanic are used interchangeably to refer to people and their predecessors who immigrate to the United States from Mexico, Puerto Rico, Cuba, Central America, Spain, and other Spanish-speaking countries. The mean age of Hispanic groups in the United States is 25.8 years old. There's a low population of older people in this group, and many live in multi-generational homes. In the article, Caring for the Older Adult Holistically, it describes characteristics of Hispanics. Number one, the Hispanics live in family households that are larger than non-Hispanic whites. 2, more than 2 in 5 Hispanics have not graduated from high school, and there's a variation in education attainment there. 73% of Cuban population has completed high school compared to the 51% of Mexicans. Hispanics are much more likely to be unemployed than non-Hispanic whites. Hispanic workers earn less than non-Hispanic whites, and Hispanics are more likely than non-Hispanic whites to live in poverty. It is important not to stereotype while meeting the needs of all ethnic and cultural groups. In the article, Cultural Traditions of Healthcare Beliefs in Some Older Adults. The traditional beliefs of older adults concerning health do not readily work well with the modern healthcare treatments today. Some traditional Hispanics think that good health goes with good luck, and that if they're in bad luck, it's a gift from God, and it's not something to be taken for granted. People with the philosophy are expected to maintain their own good health by eating nutritious foods, exercising, and getting enough rest. It is their responsibility to maintain balance in the universe. Illness is seen as a punishment for wrongdoings, and it is combined through prayer and the use of ampules, figures of clay and metal, herbs, and spices. In the Evercare study of Hispanic family caregiving in the United States, overall Hispanic cultures assume the responsibility of caring for the elderly person. There are few older adults that live to be older than others and treated with respect and love. Hispanics generally do not admit older people into nursing homes and avoid hospital stays whenever possible. They feel the responsibility to care for the older adult in the home surrounded by family. A culturally aware care provider will need to assume the role of patient advocate and inform the nurse and appropriate staff of the desires of the older person. Hospital admissions can be avoided with a strong home health care plan. Appropriate teaching is required for family members assuming responsibility of the cares. Teaching can be challenging for English as a second language. So the facility needs to be aware of the list of language skills to be called. In Hispanic American culture and health, Hispanics should be screened for diseases of poverty such as malnutrition, tuberculosis, and homicide. It is important to ask Hispanics if they feel safe in their neighborhoods, such as are they going for walks, do they visit the local recreation center, do they visit their neighbors, and if not, that means that they're staying in their homes for long periods of time and should be assessed for depression, muscle disuse, and loneliness. Time orientation is a barrier, definitely. For most Hispanics, time is relevant but because minimum attention is given to the exact time of the day. It becomes a problem with the elderly leaving a folk healer to go to a physician because the folk healer goes to the patient's homes 24/7 while a physician can only be seen in an office. Hispanics may believe in treating hot diseases with cold remedies or vice versa, so you need to ask, find out from the patient, write it down, add it to the care plan, and communicate that to the nurse or team leader. This can also be resolved by determining what the hot and cold disease and medication may be. For example, they believe that penicillin is a hot medication and should not be taken for diarrhea, constipation, or a rash, which are hot diseases, and thus saying for diuretics being a cold medication, you should not have bananas, raisins to treat that. In the health and health care of Hispanic Latino American elders, frequently Hispanics come to the healthcare systems when their disease is well developed. And it is important to understand rather than criticize them. In conclusion, the European and Hispanic American need culture-specific nursing cares, and it is our responsibility as human beings to respect their cultural beliefs and to provide them with the best medical care possible. References. Bye.